It's true that the strike has hit us very bad, and it's true that all the staff in the hospital are working. They're not part of the strike, and the hospital has recalled the staff who are on leave. So in terms of the increase, in terms of admissions, we've gone like 300%. In terms of deliveries, the actual deliveries we are seeing, we've gone 100%. We used to do like about 30 deliveries per day. Now we are doing 60. Cesarean section rates have gone by 50%. We used to do 17, 24 hours. Now we are doing about 25. So these challenges, for instance, the admission now we have no beds. Patients are laboring, like they are sharing the bed 2 or 3 in one bed because we cannot expand this labor ward. While you are willing to work, the infrastructure here has a limited capacity of how many patients we can handle. However, we cannot turn anybody away. So some are even delivering while they have nowhere, to really. But we try to improvise. We can find them sharing the beds. In terms of the cesarean sections, the emergencies have really increased. So we've now have a second theatre working 24 hours. We've even have a provision of a third theatre because we've recalled the staff. The hospital also has put in something we call locum, short-term measures where people can be given paid to work for some extra hours, who are off duty or other people from elsewhere who are willing to provide the services. So the management has tried what they can do their best, but we are constrained with the infrastructure that there's just much we can do.
How many doctors do you have?
It's not a question of doctors, but how many doctors per shift? I have the hospital, the department here has about 19 doctors, but now in any one single shift, because this is a big department, so you'll have one doctor. The way it is arranged, that floor you've seen needs a doctor to man it. Then we have the maternity wards. Okay, we have like about, are there 3? The maternity wards.
There are 3.
The 3, each of them must have a doctor doing a round at any particular time. So those need support the doctor. Then we have the theatres I've talked about. Those are now 4 doctors working at any time. Then we have 2 theatres running at any time. So you need 2 doctors during the day, another 2 doctors at night. So those are 4 plus the other one 7. Then the third theatre, which we also have for emergencies if when we are overwhelmed with this. So 7 doctors at any particular time are required to provide the services. But the doctors have decided to work extra times. They have cancelled their offs. The consultants particularly, they have made emergency rotas. I think we have some of those rotas here. So they have cancelled their free times and they're here to help the patients.